Hello again, everyone. Mark Hackle, Macomb County Executive, and John Paul Ray, our Deputy Executive, just giving you an update on what's going on with the coronavirus here in Macomb County and some of the things we've done a little bit different. We know people go to macombgov.org for their information, and we try to keep it new, updated, and a few changes we make. But one of the ones we made was to deal with somewhat of a, if you will, the graphic that we're putting together, in particular, dealing with the cases. You know, we know it's just continuously seeing the climb in cases, the climb in number of deaths, but we wanted to kind of isolate that so people can get a determination of what's happening on a monthly basis to see what's happened at the onset in March versus where we're at now. And I got to tell you, it's very compelling if you start looking at the factors that have played into this during those time frames. And we'll explain that in a minute, but if you can, just kind of run through the actual numbers on that.
Mark, it's fascinating to look at where we were at as a county dating back to March 13th when we issued our emergency declaration. The month of March, Macomb County realized over 2,500 cases and 67 deaths. When we got into April, it shot all the way up to 3,400 cases and nearly 600 deaths just in those 2 months alone. Since then, we've been on a steady decline, not only in the trajectory, but where we're looking at in May with only 803 cases, June 451 cases, and now in July at 269. Respectively, in each one of those months, May 165 deaths, June 43 deaths, and currently as we sit here today in July, we've only had one death affiliated with COVID here in Macomb County. So again, as the conversation has gotten to a slight uptick in cases or some of the issues that we're seeing in some other states, in Macomb County, I think we're again in that containment phase. As we phase in more elements of the economy, we are going to see those increases in cases, Mark, but I think what it boils down to is our ability to manage and maintain.
You know what, I don't want to call it an overreaction, but I think anybody who didn't expect that there was going to be some, I guess, uptick or increase in cases when we started opening the economy, and the governor did that. She eliminated the stay-at-home order. And when those numbers that John Paul just got through relating to you, if you start looking at that, when we got rid of the stay-at-home order, we opened up the economy, started putting people back to work, and people were starting to have those close contacts again. We expected something was going to happen. Hospitals were prepared for it, our health department's prepared for it, we're doing the contact tracing. Nobody expected that it was going to go away, not even the governor. So by opening it up, we've seen the numbers continually decline. I mean, suffice it to say, that's a good sign that we're seeing only one death so far in this month that's been reported. That's incredible. So what is that telling you? People are abiding by CDC guidelines. I think they're paying attention. They're trying to do the best they can. And are there some organizations or some departments or businesses or people doing things that maybe are a little bit too outside the bounds and creating a little bit of a problem? Yeah, absolutely. We're going to deal with that. But boy, I'll tell you what, suffice it to say, what this tells me is people are being part of the solution. We're opening the economy back up and the numbers are going down. Healthcare providers are able to handle any of those influxes. So, again, I just got something that came across. I don't normally do this, but I got to kind of relay this. Chad Livingood from Cranes, he just kind of sent something out and basically just gave everybody an indication of what was in a New York Times article. And the numbers that he's showing here that actually that came out are pretty compelling if you think about it. You're talking about Florida cases up 1,400%. South Carolina, almost 1,000%. Arizona, almost 900%. And Texas, nearly 700%. Yet in Michigan, since we've gotten rid of the stay-home order and allowed businesses to go back to work, only 16%. I mean, I get it. I mean, I don't think anybody thinks that we're not going to see some type of an uptick. I mean, it's going to happen. But to all of a sudden try to figure out, okay, how do we shut things down again and go back to, phase 3, which I remind everybody, bars are in phase 5. If the entire state's in phase 4, how did bars get open to begin with? There is so much confusion right now with the various 100+ orders that are out there that people really don't understand what can be, what isn't open. I keep telling folks, if you're calling us, I got the same challenges. We're trying to figure out how do we make sense of some of this. You need to call the governor's office for clarification. We're having a challenge with that ourselves. And when it comes to making a determination as to who enforces this, if they're the governor's law, again, it's not the legislature's law at the state level, it's the governor's law. If it's her law, she's going to have to try to figure out how to get the state police or someone else to enforce that. Our health department is going to be working with every business here in Macomb County, engaging with them to try to make sure if somebody does connect with or has some kind of a positive test, we're going to be working with them to figure out what's going on with that particular, I guess, company or business or individual. So we're going to continue to do that here in Macomb County, and our businesses have done a fantastic job of working with us, and I got to say, so are the people. We're not here to berate them. We're not here to challenge them. We're here to try to figure out how do we work with them during this economic crisis and health crisis, and we've been doing just that. We've been doing a great job of working with everybody here within Macomb County, with our health department, emergency management, and our planning department when it comes to dealing with the businesses here in this county.
Mark, I think it's interesting as we look at these facts and figures. Again, there's going to be alarming cases as it continues to build and build every single day. But I think there's another statistic that's absolutely essential that we speak about is the fact that currently in Macomb County, there are nearly 6,000 individuals who have recovered from contracting the coronavirus. So whether it's the guidance and support they've gotten from the health department, whether it's the affiliated healthcare systems in the county or those primary care physicians, the system is in place here in Macomb County to respond to wherever the trends go, wherever the numbers go, or wherever the need is. I think we're confident of that. We've illustrated our capacity, and that's where we're going to continue to advocate for being part of the solution.
And hospitals are telling us, even though we are seeing a slight increase in number of cases, in fact, in spite of the fact that the economy has been opening and we got rid of the stay-home orders and we knew this was going to happen, they're able to handle it, and there are very few cases there are people that need to be hospitalized, and very few cases where we're seeing deaths as a result or attributed to it. So things are getting better. I mean, is it going away? No, not until there's some type of a vaccine that's produced or whatever. And yes, everybody still needs to be mindful, but it's incredible to see the amount of tension that's still rising from it. And I got to say, a lot of it is, I think, promoted by public officials, and we got to stop doing that. We got to be mindful. We got to be monitoring what's going on. Realize it's still here. Convince people to stay 6 feet apart, wear the masks, and the whole social distance stuff. Everything you continuously hear. We agree. You need to continue to do that. But to say that we need to step back now and punish everyone for the actions of a few that sometimes get displayed on social media, boy, I don't think that's appropriate. I think we need to realize, what, we can work with our businesses. We're going to do that, and let's continue to work together as we monitor this. But there is an economic crisis that is here, and it's upon us. Taking a step back, I think, is going to be very challenging, especially, I don't know what data or numbers they're talking about or looking at in Lansing, but the numbers we're looking at don't show that critical of a challenge or problem that we're seeing. We all need to be part of the solution, I agree. But with that being said, shutting the economy back down, I think, is a very, very dangerous thing to do on behalf of the economy. Yet I know we can still try to figure out how do we work with people on the health side of this. We're able to do that.
Mark, one of the groups that we've been working with in lockstep is our business community. This week, on Tuesday, you had the opportunity to launch Phase 2 of Macomb County Cares for Small Business. We're looking at those businesses that over 50 individuals, employees, less than 500, $10,000 grants available. Again, you go to macombgov.org. You'll be able to click on the Macomb County Cares for Small Business link and get the applications.
And every one of those businesses have already been through our warehouse collecting PPE. We've had PPE available for every business. They've been asking for it. They want it because they want to protect their employees. They want to protect the people that are coming into their facilities. And we've been able to provide that. So we're very fortunate. So again, it's interesting. We're upon some challenging times, but if you do look at the data, the numbers, I think people are being part of the solution. Sure, there's a few out there that kind of want to go rogue or go in their own direction. Okay, we'll accept that. We'll deal with that. But there isn't anything we can't work with and engage with, whether it's individuals through contact tracing with our health department, or if there's a problem at a particular health club, if it happens to be a restaurant, a bar. We've been working with them from our health department, and we're going to continue to do that. So, we're fortunate. So, again, we'll wait and see. People are asking me, what phase are we in? Are we in 3, 4, 5? What does this mean? I'm just going to say it. I'm very confused. We're having a hard time understanding, exactly what to tell a lot of these business folks and even individuals. So, for those of you at home that are paying attention to this, please don't get into arguments or fights with people that are in a restaurant that maybe aren't wearing a mask, because even that's confusing now as to whether or not in a public building, whether it's a restaurant that you might be in, do you have to wear a mask, not wear a mask? Our understanding was it's up to the proprietor to make that determination. Now we're hearing that it might have been some other past order that still requires that. In fact, there's an order that says if you're within 3 feet of somebody in a public building, you have to have a face shield on, and that still apparently exists. So again, there's a lot of confusion on this, but we just don't want people arguing amongst themselves, chastising people, and creating more of a problem, specifically for law enforcement to have to respond. That's becoming a challenge right now.
Mark, it goes back to the civility, it goes back to the personal responsibility, and it goes back to the level-headedness. whether it's an individual wanting to take those extra precautions, whether it's a facial covering, whether it's using other options as far as providing for your family, shopping, social experiences, all those different types of things. You put yourself in the situations that you feel most comfortable with, and you're always aware of the risks because this virus is community spread. It's something we've been talking about for months and months and months now, and undoubtedly, as you've highlighted, as we've phased in different elements of the economy, as we've lifted the stay-at-home order, as more people engage in those normal courses of action, yes, cases will increase, but it's our ability to maintain and manage.
Yeah, and we're going to continue to work through this, and eventually we'll get through it, okay? But on a good note, positive note, as well as our numbers here, the Census 2020, it's interesting. Michigan keeps kind of vying for that third, fourth spot, nationally, and right now we are in third place as far as people responding to the census. In Macomb County, I believe we are 16th. Yeah, we're 16th right now.
For all counties.
For out of all counties in the entire country.
There's 3,100 of those.
Yeah, and
so that's pretty good.
In Michigan, there's only one that's ahead of us right now, and it's Livingston County. We're close. We're neck and neck. They're in 12th place right now nationally. Macomb County happens to be 16th place nationally. That's a good statement. I mean, it's a great testament to the folks here that realize, you know what, if we fill out that census, it brings back money here to Macomb County from the federal government. So it's our tax dollars coming back to us and working for us. So we're going to continue to encourage people, if they're at home, you got an opportunity to go online, fill out that form, try to make sure people understand that we are wanting to be counted because it brings back funding for us. So Census 2020, bring back our money. So,
Mark, it's been great not only doing the different types of meal events that we've been doing as a census outreach and everything in a number of communities throughout the county, but as our community action agency, Ernest and the team have been reaching out to all those traditionally undercounted or underrepresented groups and highlighting the fact that there is a direct benefit of answering those questionnaires, clarifying any of the concerns or questions that might be out there. There is a benefit to our entire community here in Macomb County.
Yeah, and on a unique note, to show that we're still working here as a government, trying to provide services. Jeff Randazzo from our animal control the other day had to go out and try to find an alligator on the loose. So it's only about a 1-foot pet alligator, but for some reason somebody left the little pen door open out in the backyard and it got away. And so we're trying to locate that. So if anybody's paying attention, happens to see an alligator in their backyard or running
16
around,
Mile in Little Mac area.
Please, yeah, exactly, out in Clinton Township. Please get a hold of us. It kind of sounds we're lighthearted about it, but it is somebody's pet, and people may differ of opinion whether somebody should or shouldn't be able to do that. Let's just suffice to say we're still trying to find that little rascal and try to get him back to the owner. We don't want any harm coming to it, or obviously it harming someone else. I'm hearing that there's more an opportunity for it to be prey as opposed to being a predator. So with that being said, if you happen to be in around that area, help us out with our animal control and see if you can't locate that loose alligator here in Macomb County. Never thought we'd have to be talking about how do we track down loose alligators.
Always
think that's
interesting,
in Florida
Mark.
or something.
Always interesting.
That's a daily occurrence down in Florida. So
Mark, I think one of the other interesting things that we've been discussing over the past 2 weeks since June 30th, when the governor released her return to learn strategy, we've been in direct contact with Mike DeVault and the ISD, developing these hybrid strategies of how we can support our schools' objectives as we phase back in education. Right now, there really is no definitive path forward as we're continuing to track the numbers, but we just want everyone to know out there that over the next couple weeks, we have a number of meetings that have been scheduled where we're looking at everything from investing into technology, ensuring school safety, and providing direct access to those individuals as we re-engage our K-12 system in the county.
And that's a good point, because I get a lot of questions about that. We get a lot of calls, emails, people asking us what is going to happen, what are we going to do. Again, this is all dependent upon what the governor decides. And now we're being told be ready for something if it's a phase 5, phase 4, phase 3, and I still don't understand what those phases really mean. I can't help but go back to that. Bars and restaurants are in phase 5. We have never hit phase 5, yet bars and restaurants are open. So this whole idea about it being a 3, 4, or 5, now the schools have to prepare for one or all of those possibilities. What that means is across the board. So this is somewhat confusing, and we're going to try to wade through it as best we can, and if we get some definitive answer or more specific information as to what we need to do, we will certainly pass that along. But in the meantime, we're waiting, like many of you, for a little bit more clear or kind of a definitive direction as we kind of try to get through that. But you know what? Credit to Mike DeVault, the ISD, and all of our superintendents who have been engaged with this since the beginning. When they had to close school down, they were starting to think about this already. How do we reopen if and when we reopen? I mean, I'm telling you, they've been they've been really at this as a united front. I mean, I'm impressed by what we've got going here in Macomb County with our public schools, and in particular through the ISD.
Mark, whether it was the alternative learning strategies that they had to develop in mid-April, or it was the emergency food assistance, which started directly when schools were shut down, it has been absolutely inspiring to see the response from Mike DeVault and our entire K-12 system throughout the county. Definitely something that we're not only going to continue to champion here, but illustrate that that's going to be an outlet where we'll ensure that we'll advocate for student safety and also for that workplace safety elements too.
That's right. Tell you what, a sense of pride. I'm a public school. Warren Consolidated graduate. You're Romeo, weren't you? Romeo kid.
Yeah.
So, all right. On that note, we just want to say once again, thanks for tuning in. We hope you continue to use macombgov.org for your information source. And in the meantime, on behalf of JP, myself, and the rest of us here in Macomb County, we want to make sure that you keep you and your family safe.